Top 10 most frequently asked NMC licensing questions for general paper. Question 1. Amidu fell with the stomach and got punctured at the chest. A penetrating wound of the chest may permit air to enter the pleural cavity, resulting in A. Empyema, B. Pneumothorax, C. Emphysema. The correct answer is B. Pneumothorax. And the rationale is that pneumothorax occurs when air enters the pleural space, causing lung collapse. It is a common complication of penetrating chest injuries. Empyema involves pus in the pleural space, and emphysema is a chronic lung disease, not a direct result of trauma. Question 2. Which of the following is at the greatest risk for post-operative nausea and vomiting? A. 81-year-old 55 kg following cystoscopy under local anesthesia. B. 45-year-old 70 kg man following an arthroscopy under epidural anesthesia. C. 23-year-old 125 kg following a diagnostic laparoscopy under general anesthesia. And the correct answer is C. The rationale is that younger female or obese patients undergoing surgery under general anesthesia, especially laparoscopy, have the highest risk for post-operative nausea and vomiting due to increased anesthetic exposure and sensitivity. Question 3. A serious danger to which a patient with intestinal obstruction is exposed because of intestinal suction is excessive loss of A. Vitamins and minerals, B. Water and electrolytes, C. Protein enzymes. And the correct answer is B. Water and electrolytes. The rationale is that continuous intestinal suctions leads to dehydration and electrolyte imbalance, especially loss of sodium, potassium, and chloride. This can cause metabolic alkalosis if not corrected promptly. Question 4. The symptoms to be observed in a patient after radium insertion for cancer of the cervix that are indicative of a radium reaction are A. Vaginal discharge and excoriation, B. Nausea and vomiting, C. Pain and elevation of temperature. The correct answer is B. And the rationale is that radiation sickness may present with nausea and vomiting due to systemic absorption of radioactive material. Pain and fever suggest infection and not radium reaction. 5. The characteristic of the stage of progression in the development of cancer is A. Oncogenic viral transfusion of target cell, B. Continual steady growth facilitated by promoting factors, C. Proliferation of cancer cells in spite of host control mechanism. The correct answer is C. Proliferation of cancer cells in spite of host control mechanism. And the rationale is that during progression, cancer cells multiply uncontrollably and become invasive, escaping immune control and forming metastasis. Question 6. One of the functions of the circulating nurse is A. Assisting the surgeon by anticipating the required instrument, B. Setting up the sterile trolley, and then C. Ensuring safe functioning of the theater equipment. The correct answer is C. Ensuring safe functioning of the theater equipment. And the rationale is that the circulating nurse is a non-sterile team member who ensures the operating room environment is safe all equipment functions properly and the patient's needs are met during surgery. Question 7. At the OPD, Alan complained of sharp pains in the urethra when urinating, followed by creamy discharges. Immediately after urinating, a diagnosis of UTI was made. When assessing the urine of the patient with urinary tract infection, the nurse should assess each specimen for A. Specific gravity, B. Clarity, C. Sugar and acetone. And the correct answer is A. Specific gravity. The rationale is that specific gravity measures urine concentration and hydration status, which may change in infections due to altered kidney functions and fluid loss. Clarity may be affected, but is not diagnostic. Question 8. After cataract extraction, the nurse should A. Instruct the patient to avoid driving for 2 weeks. B. Advise the patient to refrain from vigorous brushing of the teeth and hair. C. Teach the patient coughing and deep breathing exercises. And the correct answer is A. Instruct the patient to avoid driving for 2 weeks. The rationale is that following cataract surgery, vision may be impaired temporarily, and sudden movement can increase intraocular pressure. Driving should be avoided until cleared by the ophthalmologist. 9. A client reported to the health unit with complaints of intermittent rectal bleeding, cramping, abdominal pains, and diarrhea. He was diagnosed with ulcerative colitis. Which of the following diet would be appropriate for the patient with ulcerative colitis? A. Low residue, high protein. B. High fiber, low fat. C. Low protein, high calorie. The correct answer is A. And the rationale is that a low residue, high protein diet minimizes bowel irritation and supports healing. High fiber foods worsen inflammation and diarrhea in ulcerative colitis. Question 10 and the last question. The definitive diagnosis of benign prostatic hypertrophy BPH is arrived at by, you have A. Rectal examination, B. Biopsy of prostatic tissue, C. Pap smear of prostatic fluid. The correct answer is A. Rectal examination. And the rationale is that digital rectal examination (DRE) is the first and most definitive bedside method to detect an enlarged, smooth, non-tender prostate typical of BPH. Biopsy is used to rule out malignancy when cancer is suspected.